Most people can't be bothered with going to the doctor unless they feel pain. Just getting there and waiting around to see a physician is a bother, especially for seniors who don't have adequate transportation or funds for a copayment. So if you're worried about a little hearing loss, well, many people would think, why even bother schlepping to the doctor's office? But treating hearing loss has the best outcomes when detected early. For all these reasons, SeniorLiving.org has designed an online hearing test. It's free, easy, takes just 5 minutes, can be done from the comfort of home, and requires no special equipment but a pair of headphones. But don't just listen to me. In this exclusive interview, audiologist Brad Ingrao explains why he thinks you should take this online test. He also explains why, if left untreated, hearing loss can lead to many other health problems. Because of social distancing, we will be conducting the interview on Zoom. Hi, it's Jeff Hoyt, Editor-in-Chief of SeniorLiving.Org. And today, once again, I have the pleasure of speaking with Dr. Brad Ingrao. Brad is an audiologist, and I want to talk to him about our online hearing test. Welcome, Brad.
Thanks, Jeff. It's good to see you again. It's been a little bit of time, but it's also good to hear you. And I'm really happy to talk about this online hearing test because I think it's a really important part of getting people to start to think about their hearing as part of their overall general health. I found it to be quite nice because I did a hearing test on myself first, a standard one, and then I did your test, and the results were really quite similar. I used to have a problem with this because my hearing, knock wood, was perfect well into my 50s. But about 6 months ago, I had a short-term sudden hearing loss in my right ear, which mostly recovered, but I still have a couple of those high pitches that aren't as good as they used to be. And what I liked about your online test was it picked that up. So I had to push the button a couple extra times in that right ear, which makes me feel pretty good about the fact that while it's not a diagnostic test, it's certainly a good way for people to kind of take the temperature of their hearing.
Well, great, because that's really what I want to start with, is ask you why other people who are not audiologists should take this free online hearing test from SeniorLiving.org.
I think it's important that we start to bring some general health awareness into people's everyday lives. And just like that blood pressure cuff in the drugstore, the easier we can make it for people to start to think about some of those parts of their health that may begin to degrade. And if we can find out when there's a problem really early on, I think it's only going to make people more willing to take the next step, which is if they do find there's a little bit of an issue with their hearing, they'll go and see somebody. The other thing I really like about it, and with all of the talk of over-the-counter hearing aids, I thought a lot about why people don't come to my office. And one of the reasons they don't come to my office is open when they're at work. And my office is not open when they're not at work. And so having something online, even if it's just that beginning screening part, I find is really, really important in breaking down some of the barriers of access that are keeping roughly 4 out of 5 people who have hearing problems that are bad enough that it's interfering with their lives from doing something about it. If I start out with an online hearing test and it says like hey, Jeff, you're doing pretty good, great, then I'm okay. But if I'm having difficulty and I really can't take time off because I don't have paid family leave or anything like that, I could take this test and it could say, hey, Brad, you are starting to have some difficulty. And I really like the definitions and the descriptions at the end of the test that tell me what kind of problems I might have day to day with different kinds of hearing issues. And that might be the kick in the pants I need to say, okay, you know what? It is worth it for me to take a sick day and make an appointment and go and actually get this taken care of. Because we know lots and lots of data. If I don't take care of my hearing loss, I begin to become socially isolated. I stop interacting with my family. And all of those things make me less well. If I'm less well, then I don't enjoy life as much. And the entire thing I like about SeniorLiving.org is as I'm getting close to that senior part, and as I have family members who are into their senior years, I want them to be healthy seniors. I want them to be active seniors. I want them to be thriving seniors. And everything that we can do to take away obstacles, to breaking down those barriers, I think is a fantastic thing. The hearing test online is not going to replace me. I don't feel any threat from that. It can only open doors. It can only introduce people to the concept that they could hear better, they could communicate better. And knowing that, I believe, is only going to get more people in the door of those traditional hearing tests. Getting people in the door is only going to help my profession, but more importantly, it's going to get those people who really do need to do something about their hearing to at least have a point of reference. And the other big thing I love about this is I can do this in the privacy of my home. I don't have to walk into a big building that says hearing aids on the top of it. And so the beauty of online hearing testing or screening is it's a zero stigma environment. I can wait till my entire family is away or asleep. I can sneak into the living room. I can put my earphones in and I can do this. And I can then reconcile within myself privately what my hearing situation is without somebody barking at me, without going into a sterile medical facility. And not for nothing, but those little sound booths we stick you people in are not the most comfortable places to be. I'd rather sit on my couch.
Understandable. I have to be honest, I was actually in a sound booth like that today. Didn't find it to be that uncomfortable, but I do understand the whole stigma. I just had a little episode that of course cleared up before I made it to the audiologist, but I checked my hearing with the online test like you did, and I also had it checked professionally, and the results were quite similar. But you said you're not worried about a test like this replacing you. So what can't an online test check that an audiologist can check?
The reason, Jeff, that I'm not worried that a hearing test like this is gonna replace me is because there are things that I do that something like this really can't do. I can look in your ear. I can examine your ear canal. I can do some more sophisticated testing, something called bone conduction, where in addition to listening through earphones, I can have the sound travel directly to the inner ear. And that helps us kind of evaluate the position of any hearing loss, whether it's middle ear or inner ear. We can do some more sophisticated tests like otoacoustic emissions, which really looks at the mechanical function of the inner ear. And we can do some fairly sophisticated speech understanding tests. All of that is great, but we also can have a conversation. I can have a conversation with you, and if your hearing test graph is identical to another person, but you have very different lifestyles, my treatment options to you are going to be different. And so, again, I feel like there's a lot of potential fear about, hearing aids going online and hearing testing going, what's going to happen? That's my job, to differentiate myself professionally from the technical component. I'll be honest with you, if everybody who came to see me had a really good online hearing test first and sent me those results, it would save me a lot of time in terms of pre-thinking and help me kind of plan your care. So I see it as a benefit. But again, the biggest benefit I see is the more people we can get to find out that they don't have a hearing loss is great. But those ones that do, roughly 50% of seniors are going to have some amount of hearing loss. I want them to start to work on better communication skills, maybe adjusting their TV settings or something like that, or beginning to use some of these initial tools like hearing training and that sort of. I want them to do that really early so that when they get to the point of needing hearing aids, they've already got good hearing habits, better communication habits, and we can kind of dive right in. So I really feel like this is a potential collaboration with audiology to bring more people in. Very few people who sell cars are upset because we advertise cars on the internet. Because what ends up happening is people buy a car, and even if they buy it on the internet, they have to have it serviced locally. So that brings more people into the car buying business. This is going to bring more people into the hearing awareness business. And eventually, those who have hearing loss, I hope, will begin to get into the hearing correction business much sooner so they have better outcomes. And people who have better outcomes tell their friends, hey, you know what? Hearing aids and hearing care is a good thing. People who wait 10 or 15 years, typically it's about 7 for the traditional hearing care process, they have worse outcomes. And when you have a bad outcome, what are you going to tell your friends? These hearing aids aren't very good. I don't want, it was a waste of time. It was a lot of money. But if we can get people in the door early, if they can get better outcomes, they'll become better ambassadors for better hearing. And that's going to benefit everybody.
So like all the other things that happen in life, that illnesses and whatnot, the early detection, the more options you have, the better the treatment, the better the outcome can be.
Absolutely. Absolutely.
And so when someone takes this test, it's, as you said, it's purely diagnostic. It's not, it's just recording whether someone does need correction or not. And if you pass the test with flying colors, great. You can take it again 6 months, a year down the road. But after taking it a dozen times, and then you have one test where the results are less than the baseline you've established, then you say, hey, maybe it is worthwhile for me to go to that building where there's a big hearing aid out in front and there's some stigma, but it's worth it because I can see my hearing's not as good as it was the last time I took the test.
Exactly. And the other thing that's important for me is if you have taken this test every 6 months for 3 years and there hasn't been a change, and now there's a change, if you can bring me those results, that's important for me because I can also look at why is it that your hearing is changing all of a sudden? Is this something that we need to be concerned about medically? Or is this something that, well, you hit a certain age milestone and that kind of makes sense? So again, I feel like more information is better. And I've really never felt that, audiology needed to be the gatekeeper of hearing care. I think it should be available to everybody. I think hearing enhancement should be available in every consumer electronic device so that we can customize our listening experience and then give some information and education on when it's time to go and seek professional help.
Great, really appreciate it. I'd ask you to give directions for the test, but it's so easy. People can just follow along and do it themselves, and it takes about 5 minutes. But in closing, can you just explain to people why it's so important to keep track of their hearing? In other words, it's not just, oh, I'm not hearing as well as I should, but how that can mushroom into many other problems throughout someone's emotional and physical health.
Yeah, absolutely. So here I am. I hear well. My friends, we can finally go back out. COVID's under control enough. Let's go out. And I go out and I, have dinner with my friends and I'm enjoying it and I'm be able to communicate. Jeff's across the table. I can talk to him and my friends are there. And I enjoy that. And I want to do that more often. So whenever somebody calls me and says, hey, you want to go out? Yeah, sure, I'll go out. You want to come over and play? Yeah, sure, I'll do that. If I don't hear, I'm going to say, where are you going? And you're going to give me the name of a restaurant. And I'm going to know that I don't hear well in that restaurant. So I'm going to say, I'm going to take a pass on this one. And then I'm going to take a pass on cards at your house because it's a little hard to hear there. And what happens to me, I begin to socially isolate. Isolation leads to predisposition to depression. If I sit around all day and I don't go out and I don't walk around and I'm not active in my community, I gain a little weight. As I get into my 50s and 60s, maybe I get a little pre-diabetic. And so what we see going all the way back to studies in the 1990s is untreated hearing loss equals lower overall health and predisposes you to being unhealthy. If you're unhealthy, you're going to be unwell. If you're unwell, then your quality of life, your emotional situation is not great. It also affects your family. It degrades your family interactions. And we know how important family is, particularly after this COVID 2 years where people felt isolated. They really lost those connections. And so when we want people to be happy and healthy and well overall, they need to be able to communicate to do that. So there's a little bit of information out on the internet of some coincidental findings of early hearing loss and early memory. But I always caution people to read those very carefully because it's not a causation, it's a coincidence. So people who are beginning to have memory problems, who also have hearing loss, who also continue to be socially isolated, you can kind of snowball that, but it's not a direct connection. more importantly, it's that if you're not communicating, you're not participating. If you're not participating, you're not thriving. And so we want people to thrive. We want them to be out of the house more than in the house. And hearing is a really, really important part of that. Helen Keller always said, I'd rather be blind than deaf, because blindness separates you from the things in the world and deafness separates you from the people. And we're social animals, and we need to be around other people. And if we can't hear well, we begin to voluntarily opt out of that. And so opting out leaves you on the couch. It adds 20, 30, 40 pounds. And before you know it, you're dealing with all kinds of health problems.
Well, I really appreciate you summing it up that way. So it's free, it's easy, it's quick, and it can keep you from going down that path, our free online hearing test. So thank you very much, Doctor. Really appreciate you taking the time.
Sure, my pleasure. I would encourage everybody watching this video to take the test. And listen, best case scenario, you get a thumbs up. Worst case scenario, you come see one of us. We're nice people. It's okay. We wear white coats, but we're not scary.
It's true. They are nice people, audiologists. Really appreciate you taking the time. Thanks, Doctor.
Take care, Jeff.